Hi, my name's Sarah Luin, and I'm one of the pediatric physical therapists here at Central Texas Pediatric Orthopedics. In addition to pediatric orthopedics and sports-related injuries, I also specialize in treating patients with scoliosis using the Schroth Method. I'd like to tell you more about scoliosis and therapy options we have if your child has been diagnosed with scoliosis. Scoliosis is a three-dimensional deformity of the spine. When you look at the spine from behind, one of the hallmarks is that the spine deviates from midline into an S or C-shaped curve. When you look at the spine from the side, the thoracic region of the spine, or portions where your ribs attach, will flatten. The natural curvature of the spine seen when bending forward will be lost. This is one of the tests used to detect scoliosis, as often we find a rib hump or prominence. The third plane that the spine moves is to rotate. As the bones move on top of one another, they create the S or C-shaped curve that we see on X-ray. Scoliosis affects 2 to 3% of the population, and onset is typically between 10 to 15 years of age. It's most important to detect scoliosis during adolescence because this is the time period for rapid growth and opportunity for the curve to progress the most. For more information about idiopathic scoliosis, please take a look at our video from Dr. Brian Kaufman. The Schroth Method is a research-based approach towards conservatively treating patients with scoliosis, kyphosis, and other spinal deformities. The goal of this method is to stop or halt the progression of the curve, and we do this by addressing posture to increase muscle strength and endurance. The Schroth Method differs from traditional physical therapy in that it treats all three planes of motion that the spine moves to correct posture. In traditional physical therapy, we typically can treat 1 to 2 planes of motion at the same time. As I mentioned, the bones of the spine rotate on one another. This can be best demonstrated by using a towel. As we twist the towel, the more I twist, it will begin to deviate from midline, creating either an S or C-shaped curvature that we see on X-ray. The Schroth Method works to de-rotate the spine. Treatments are tailored to each patient's specific curvature using their most recent X-ray, as no two patients' curvatures are the same. We use equipment such as wall bars, a pull-up bar, a therapy ball, or traction belt to aid in the alignment of the spine while focusing on breathing and muscle activation. Schroth exercises are a proven adjunct to patients wearing a brace if bracing is deemed appropriate. For patients who are not in a brace, the Schroth Method can also be effective. For most, scoliosis-specific exercises are performed 5 to 7 times a week for 20 to 30 minutes a day. These exercises will be performed until spinal maturity has been reached and will also benefit patients into adulthood for postural health. Schroth physical therapy appointments are typically between 45 and 60 minutes. I typically see patients once per week until they have a good understanding of their posture, ability to correct their posture, and a thorough understanding of their home exercise program. From there, appointments are decreased to bi-monthly or every 4 to 6 weeks until the spine has finished growing or spinal stability has been achieved. Each patient is different with this timeline, and I will assist you in determining proper frequency and duration of appointments. Each session is one-on-one with me, and I encourage parents and family members to participate in the sessions to be able to help patients with their exercises at home. Appointments are conducted at our Slaughter Lane PT office located in South Austin or at our Westlake PT office. For Schroth appointments, I recommend that patients wear form-fitting athletic clothing with the ability to expose their spine for proper observation and treatment. Please keep in mind that the Schroth Method is not necessarily the correct choice for every patient diagnosed with scoliosis. Our team of physicians and therapists are here to assist you and your family in the decision-making of which treatment option is best for you. I work closely with our 4 spinal surgeons to ensure proper alignment with Schroth corrective exercises. If your patient is wearing a brace, I also work with the brace maker or orthotist to collaborate on proper fit of the brace. We take a collaborative approach towards treating patients with scoliosis until they reach spinal maturity. At CTPO, we understand that the diagnosis of scoliosis, required brace wear time, and scoliosis-specific exercises can be overwhelming. We are here to educate you and ease your concerns along the way with the goal of preventing surgery. Our patients like to say they're bent, not broken, and we at CTPO have your back.